On October 16, 1846, William Morton would change the way people viewed surgery. William Morton's invention would become a turning point in medicine, changing doctors' perception of surgery. It would put an end to the agonizing pain that accompanied surgery at the time. Anesthesia would transform the way people viewed surgery forever. Before modern anesthesia was invented, doctors provided little to no relief for their patients. During the Revolutionary War, wounded soldiers undergoing surgery were instructed to hold a lead musket ball in between their teeth. The pain of surgery was so unbearable that many soldiers broke or chipped their teeth from holding onto the musket ball so tightly. Historians believe that many surgery patients died from shock. To prevent this, surgeons used narcotics, alcohol, and even hitting the patient in the head to induce unconsciousness. So how did we go from hitting the patient with a blunt object to the more humane approach of nitrous oxide? In 1798, Sir Humphry Davy, a British chemist, discovered that nitrous oxide, also known as laughing gas, relieved pain. He learned this after testing it on himself on numerous occasions. However, many people refused the anesthetic, believing it to be the work of the devil. Nitrous oxide was rejected by the medical field, and Sir Humphry Davy's discovery was instead used at parties as entertainment. There were other forms of anesthesia in other countries. In 1804 in Japan, Hanaoka Seishu, a Japanese physician, used an anesthetic made from monkshood and thornapple, two plants that were very potent. Hanaoka Seishu's anesthetic did not spread from Japan. In 1845, Horace Wells, an American dentist, performed a dental extraction in an operating theater. Wells was demonstrating the use of surgical anesthesia. William Morton and Horace Wells were working together at the time. Horace Wells performed the procedure, but the patient cried out in pain, proving that the anesthetic did not work. This led to public humiliation and ridicule. William Morton did not continue working with Horace Wells after the incident and instead went to Charles Jackson, a professor at Harvard Medical School, to discuss an anesthetic that could work. The two discussed the properties of ether. Ether, a highly flammable, volatile liquid, was important in developing modern anesthesia. Jackson suggested sulfuric ether as opposed to nitrous oxide, also known as laughing gas. Morton experimented with the ether, and he soon learned that a drop of ether on skin produced localized numbness. Further tests showed that ether could be more effectively inhaled than nitrous oxide. Ether could also be transported more easily. Morton also learned that when vaporized ether was breathed in, the patient did not become hypoxic. Hypoxia can cause difficulty breathing and restlessness, which can make it challenging for a surgeon to operate effectively. Some cases of hypoxia can be fatal. Ether could be used in smaller doses, avoiding hypoxia, unlike nitrous oxide. Morton came to understand that anesthesia could be used in a hospital setting during surgery, and he knew how much of a turning point ether as anesthesia would be in the medical world. Morton quickly developed a desire to patent the ether in the hopes of becoming wealthy. However, ether had been available for centuries, putting a stop to Morton's aspirations. Still, Morton was determined, and he added impurities to mask the scent, and called his new mixture Letheon. These events led to William Morton's successful showcase of anesthesia in 1846. On October 16, 1846, Gilbert Abbott was set to have a tumor removed from his neck in Massachusetts General Hospital in Boston. Dr. John Collins Warren was set to remove it while William T.J. Morton administered anesthesia. Morton would be demonstrating the anesthesia and how it could be used in the medical field. He would be demonstrating his discovery in an operating theater, the very same one Horace Wells had been in the year before. The operating theater is now called the Ether Dome. The anesthesia allowed Dr. John Collins Warren to successfully and painlessly remove the tumor from Abbott's neck. This was the first time anesthesia was used successfully in public. It would continue to be used and provide painless surgeries for patients. After his successful demonstration, William T.G. Morton wanted exclusive rights to his invention. He spent the rest of his life attempting to obtain these rights. However, his professor, Charles Jackson, claimed that he was also a part of the discovery. While Morton was engaged in this legal battle, Dr. John Snow, an English physician, was practicing obstetric anesthesia. He was using chloroform to help women ease the pain of childbirth. Despite the fact that it worked, it was not commonly used. That is, until Queen Victoria requested it for the birth of her 8th child, Prince Leopold, in 1853. Many people followed the Queen's lead, and anesthesia became more publicly accepted and the demand for it increased. In America, obstetric anesthesia had been used since 1847, 5 years before it had been administered to Queen Victoria. However, there was a great deal of controversy surrounding it, and it was not as commonly used until it was administered to Queen Victoria. Many people believe that because of the curse of Eve, women were expected to suffer during childbirth, and anesthesia took away from that experience. However, many other people believe that anesthesia could create a new era in childbirth by eliminating the pain. Anesthesia had also begun to be used on the battlefield to help wounded soldiers ease their pain. William Morton died in 1868 without the rights to ether, but the use of anesthesia did not die with him. During the Civil War, anesthesia was a very useful tool. It provided at least a small amount of comfort to injured soldiers who required surgery. Anesthesia was so effective that soldiers did not even notice when limbs were being amputated. When Thomas Stonewall Jackson required an arm amputation, he said, quote, "I had enough consciousness to know what McGuire was doing, and at one time I thought I heard the most delightful music that ever greeted my ears. I believe it was the sawing of the bone." Anesthesia was used over 80,000 times during the Civil War. Out of the 80,000 cases that it was used in, only 43 deaths were anesthesia-related, which is 0.05%. Chloroform was used as an anesthetic instead of ether, as it acted very quickly, could be used in small doses, and was non-flammable, unlike ether. Anesthesia was very light, which could have led to the misconception that anesthesia was not used. During the Civil War, the Confederate side had the disadvantage of not getting as much anesthesia as the Union due to shortages. Anesthesia was used on the battlefield several times after the Civil War. It muted the pain of injuries from combat and prevented soldiers from dying of shock during operations, making it a vital instrument. William Morton transformed the way people viewed surgery. His invention was a turning point in the world of medicine, and it changed the way surgeons viewed surgical procedures of all types. William Morton will be known as the man that put an end to the excruciating pain of surgery and made it pain-free for everyone.